Hi, my name is Jonathan Arnold. I'm the medical director of the Healing Center at Mercy Medical Center in Cedar Rapids, Iowa. My team and I treat about 100 patients per week in the hospital outpatient department. A lot of the changes that we've seen in our wound practice related to the COVID-19 pandemic are related to first the disease. Just a couple of comments on how that's happening in our community. I think firstly, we have had significant disease here, but we've been able to manage it fairly well for a couple of different reasons. Firstly, we have a less dense population. We also have a central location in the United States that's given us a little bit more time to prepare, just basing our response on what we've seen on the coastal regions. A lot of the changes that we've seen in our department are directly related to changes within the hospital. Firstly, we are rotating some of our staff to the screening locations at the hospital entrances. Our staff is also rotating to the regular medical floor so that those staff can rotate on to the intensive care unit. A lot of the elective procedures have been postponed, and this has also affected our wound clinic business. Also, patients in general, some are concerned about limiting their exposure to the hospital environment, and most local care centers prefer limited access and have requested only essential return to clinic for their patients to assist with isolating from the COVID-19 disease. In general, this overall has resulted in about a 50% reduction in patients coming to the wound healing center. We might be 40% reduction one week or 40% capacity and then up to 60 the next week. And so that does vary, but it averages out to about 50%. In general, we're prioritizing our patients by focusing on most acute needs and also those patients that are at highest risk just by looking at their risk factors. So for example, we are prioritizing patients that we feel may deteriorate if we don't pay close attention to them. Those generally turn out to be the patients at the highest risk, so those with diabetes, coronary artery disease, congestive heart failure, and so on. So in general, folks that are doing well, for example, a venous leg ulcer that's doing well with a compression wrap, we would generally offer to continue that therapy if the patient was comfortable with that. The same would go for negative pressure wound therapy, total contact cast for diabetic foot ulcers. Those that are in the hyperbaric oxygen therapy would also be offered a chance to continue, particularly if they were improving. So needless to say, overall, this situation has changed our patient interactions. Our primary goal of complete wound healing has not changed, but the amount of time that it's taking us to reach that goal may be a little bit longer than usual. We are seeing, as I mentioned, fewer patients in the healing center, and so more of our patients are taking advantage of the telemedicine options. Fortunately, our electronic record has an integrated solution that has worked very well to date. So for example, on a wound patient, we are sending them home with measuring devices, or we also have a transparent measuring device that they can place over the wound, which allows us to image the wound during the video conference. And let me just give you a few examples of how we might be changing some of our routine wound follow-up. So a standard wound patient would generally be offered a weekly follow-up. So a lot of those that are doing well, we might extend to 2 weeks. Those folks, we have a lot of venous ulcers. Maybe 40% of our business is a venous leg ulcer, generally speaking, in a compression wrap, applied weekly. We're trying to transition these folks out of their wrap that we apply in the clinic to a stocking or wrap that they apply on their own, and then following them up with a phone call or a video visit. So this is one area I think that, for example, CMS and Medicare have really stepped up by allowing these conferences to be covered by insurance. Patients that are doing well, for example, with a serial weekly debridement and are concerned about coming into the clinic might be offered an enzymatic debridement or extended wear dressing option. As far as the 3M products that I'm finding most useful during this time, the V.A.C therapy system and S.N.A.P therapy systems in my practice are essentially unchanged. If we think folks would benefit from those treatments, we are offering them. These are particularly useful in that they really isolate the wounds and require fewer dressing changes, and those dressing changes are performed by wound care professionals. I also like the fact that the S.N.A.P therapy system comes with a great handout that helps patients understand the therapy and troubleshoot any problems they might have between visits. We're also using Promogran and Promogran Prisma. I like the fact that these can be applied on an extended basis as a primary or a primary dressing with a secondary, for example, piece of foam over the top and left for 1, 2, 3, 4, 5, even 6 or 7 days. And then at the time the dressing is then evaluated, a lot of times the wound is better and those products have been mostly, if not completely, absorbed. So needless to say, with the extended wound clinic interval follow-up, we've had a decrease in the total number of our wound clinic visits for any one wound, and we have still full access, thankfully, to the home care services, which includes physical therapy for those individuals who would qualify and benefit. Fortunately, as far as our 3M representative, we have a phenomenal rep, and we've had full access to him via phone. And while we haven't seen him very much, he is checking in with us regularly and making sure we're taken care of. As far as the product supply and ordering, so far with regard to wound care, we really haven't seen any significant disruptions, and it's been a fairly smooth and continuous process. We are able to order for patients online through our electronic medical record, and we are taking advantage of the V.A.C therapy ready care system. We have 2 of these units there in the healing center ready to put on. And I like these because it minimizes the time to application of the product and also decreases the traffic at the healing center. As far as education and in-servicing, we are using this time. We have a little bit of extra time here and there, and we are getting caught up on our CME. Fortunately, our hospital sponsors an online educational vendor that most of us take advantage of, and we are taking time to get caught up on CME during this time. We certainly have the need for in-servicing, but haven't had as much as we are used to. But I do understand that 3M has virtual in-service options if needed. As far as my recommendations for folks in the healing centers dealing with COVID-19, my recommendation would be generally to develop a plan and execute it with reassessment and adjustment if needed, realizing that this is not a one-size-fits-all plan, and it should be developed considering local situation and policies. Also recommend, as we've discussed, triaging patients based on their ability to understand and take care of their wounds, with priority given to those high-risk folks, generally with the risk factors that we mentioned. And then last but not least, take advantage of advanced wound care products like the negative pressure therapy systems, including V.A.C and S.N.A.P therapy system, the extended wear dressings, including Promogran and Promogran Prisma, and then also for our most common wound in the healing center, the venous leg ulcer, the Covan 2-layer compression system. Thanks very much. I appreciate you joining us for this video conference. Pay attention to the information coming out from our healthcare professionals. Stay safe and certainly take advantage of the educational opportunities available from 3M.